When it comes to getting a flu vaccination, I know that some people are a little bit iffy about it. They've heard that getting a vaccination could possibly give you the flu. As a provider, how do you try to, break down that barrier and get them to actually get the flu shot? What's the importance of getting the flu shot?
So I always try to stress to my patients that, sure, when you get the flu vaccine, you may feel some sort of, potentially body aches, or you may feel like, oh, I have a cold coming on, but that's actually the vaccine, which contains, the attenuated virus. It's actually your immune system sort of doing its job. It's sort of waking up and building up that response to the flu. And that's exactly what you want, because if you were to come in contact with it, your body could be prepared to fight it. And I really draw this distinction when I'm talking to the patients. You know, driving home that immune system sort of education, and driving home the fact that, while we're waiting for a COVID vaccine, we know that we have a flu vaccine. And so we want to utilize the resources that we have, in addition to, and we know that our patients are suffering from sort of COVID fatigue and doing all the public health infection control measures. We want to, emphasize the things that we do have and the things that work, which include the flu vaccine, which really has minimal sort of side effects, and explain to them that the immune system, we're trying to rev it up and sort of prepare it, especially on the backdrop of this pandemic, where we don't have a vaccine, but we have really good infection control measures. We're talking about wearing masks, we're talking about, the physical distancing, and, washing your hands frequently, as well as avoiding large gatherings. That should help decrease the viruses in general as we go into the fall and the winter. And for me as a provider, and I encourage other, sort of providers and clinicians, so that we can have sort of this concerted educational sort of drive and initiative, so that our patients can really, sort of buy into what we're saying, because it will really help decrease the burden of circulating viruses during this pandemic we're facing.